Hi, this is Dr. Ron Fisher. I'm a chiropractor in Menasha, Wisconsin, and today's topic we're going to talk about the current healthcare crisis. For the last several years, big news topics have been that the healthcare costs have been growing astronomically, and what are we going to do to fix it? The government is right now looking at another try at fixing this, but trust me on this one, you do not want your doctor to be a government employee. If you ever concerned about that, or if you thought about it at all, just look at the VA hospitals right now. They're run down, they're dirty. The doctors in there are overworked, they're underpaid. You do not want that as your general health care. So first thing we got to do is just even quit thinking about government-run healthcare. That is not the answer. People talk about how in Canada and Europe it's great, but if you talk to people who actually are there, they tell you they hate it. They're waiting for services. Services are denied. You're on waiting lists for everything. It's just a mess. In order to fix this, the first thing we need to do is open up some competition. Right now, doctors of chiropractic and other alternate care providers are not being utilized enough. And that's the number one problem. The biggest cost with healthcare is prescription medication. If we can get people to not use prescription medication as much as they are right now, that's going to bring down costs tremendously. For every dollar that we spend on prescription medications, we're spending another $1.32 treating the side effects of those medications. If we can take patients that were being treated on a medication that could be effectively treated with a natural cure, a herbal remedy, chiropractic care, homeopathy, acupuncture, you eliminate those drug reactions, you bring down the costs. The other thing it does is that it opens up competition between healthcare providers. If, say, for example, someone hurts their shoulder, they have an option. They can see a medical doctor, they can see a physical therapist, or they can see a chiropractor. By opening up the competition that way, you bring down the costs. If you only have a monopoly, they can charge whatever they want, and that's where our costs are going. Right now, our system is a pharmaceutical prescription drug monopoly. So the big thing we want to do is open up and use more of the alternative providers. The way to do that is with health insurance, using health insurance the way it was intended to do, much like with your car insurance. Your car insurance doesn't pay for oil changes, doesn't pay for tune-ups, but if you get into a nasty accident, a big wreck, then it will come into play. Same thing with your health insurance. Health insurance was never designed to do the routine maintenance things, the checkups, the screens and things like that. It was designed to keep you from going bankrupt if you had a serious illness or injury. So if we get back to that model, do a high deductible, catastrophic insurance type program, they're very inexpensive compared to what you may have been used to, but then you have to combine that with a health savings account, something where you use pre-tax dollars, put the money in there. The patient has the choice to choose and use whatever they want that money to go towards, whether it be massage or medical doctors or chiropractors or acupuncture, whatever they want, they can use it for that as a preventive, as their screening, as their regular checkups. So by doing that, you're going to bring down costs. You're going to put the choice of healthcare back where it belongs in the patient's hands. They can choose, do I spend a couple $1,000s on this doc, or do I get a better service at this other provider for half the cost? They can make that choice. They're not tied into HMO plans or PPO plans where they have to see certain providers. And by doing that, you're going to bring down the costs. Again, big keys with bringing the healthcare costs down. Number one, getting off the prescription medication. Number two, opening up the competition to multiple providers. And number three, give the person more responsibility for their health care. And the best ways to do that is, like I said, do the high deductible insurance, the health savings accounts, and again, opening up to as many providers as you can. More competition will bring down the cost. Love to hear your comments. Please leave a message, and we'll talk to you again. Thanks.